So we are going to look at our procedure today, and that is catheterization. And we saw some of the indications why we do catheterization. And some of the indications are collecting urine sample from the patient. When the patient is having severe urinary retention, we need to catheterize to drain the bladder. When we need to irrigate the bladder, to wash away certainly moral infections. When we are preparing a lady to go for labor, those ones who normally will go under cesarean sections are those ones who undergo SVD. Then there is patients in coma. We also put a catheter because they have an urge to urinate but they cannot move to go to the toilets. Then patients who are very sick and they cannot. After knowing the indications, we are going to look at the requirements now which we need to put in place when you are going to do this procedure. One of the requirements is the catheter. We have a cotton swab, disinfectant, water for injection, syringe, gloves, lubricator, and the urine bag. So, these are the requirements I've been talking about. We are going to see one by one. So some of the requirements we have a two-way catheter. Why are we calling it a two-way? It has one inlet and one outlet. We have a three-way catheter. It has two outlets and one inlet. But this one is a two-way catheter and it is gauge 16. So it means that this one fits the urethra of a man and a woman, but not a baby, because it's big, somehow big. We have gauge 18, we have gauge 20. Yes. So we have syringes, and these syringes accompanied with water for injection, sterile water for injection. We use them for ballooning. I'm going to see how we do it. Then I have my cotton swabs for disinfecting. I have a disinfectant which is methylated spirit for doing that work of disinfectant in conjunction with the cotton swabs. I have my gloves and my mirror model for illustration purposes. So these are some of the requirements I'm going to be using in this session. After gloving, putting on my sterile surgical gloves, I hold my hands like this. Why am I holding my hands? It's not a punishment, but I'm trying to control cross-contamination and transfer of infections, either from my body to the patient or from the surrounding the patient. Are we together? Yes. Because the procedure I'm going to do is a sterile procedure. Are we together? So I'm going to start with the disinfecting part of it. So I'm going to have my assistant come here. So I'm starting with the mirror model. So I pick my cotton swab. Then I get the disinfectant from my. So I don't touch on the bottle to avoid cross-infection and contamination. So I hold my mirror model. So this is a man lying on the bed. I hold him like this. Are we together? Because at that time, the man is not erect. It's just like you are seeing here. So I hold like this, then I clean the nozzle part first. I pass it once, then I discard it. I get the next one. I pass once, I discard. Are we together? Yes. Get another one. So I start to disinfect from the glass pens. We call this one glass pens, the head. Moving down, I pass like this at once. then I drop it. Then I got again another one. Then I pass down here. I drop it. Are we together? Yes. So the disinfecting part is done. So when I'm done disinfecting, I've been using these gloves, so they are contaminated. So what I do, I will have to do what? But when I'm discarding, I first remove this one, then this one, I make sure I hold this one very well. Then I hold by the neck, then I put it inside. Even if I drop them there, even if I touch them, I cannot pick the infections. Why? The surface I've been using is what? Okay. Now, I'm ready for the next part. So I've done the infection part. Yeah? I've finished my disinfection. Then the second part is going to be what? To be inserting my gadget inside the man. All together. But before I do that, I will need to put on another pair of gloves, which are sterile. All together. So these ones are just disposable gloves, examination gloves. But on top of this one, I need to put sterile surgical gloves. All together. Another thing, as they are building gloves, this man is enclosed twice, is sealed twice. So there is this first seal, this one. So my assistant is going to hold the seal like this, then open it. Me, since I'm going to be in surgical gloves, sterile gloves, I will pick the sterile part which is inside. Are we together? Let's see how we do it. I put on my gloves. This one is in the left. Holding my cord. So when you know how you hold the cord, it becomes very easy to wear the gloves. Don't I find someone fidgeting with gloves 30 minutes wearing gloves. So you open for me. So after my assistant opening which is the sterile one. So this is the second seal, and this is the sterile seal. Since I'm also sterile with my sterile gloves, I'm going to hold the sterile seal. Are we together? The next thing, this seal has a weak point, a weak end. So you hold the weak end and you open it. After opening it, you do what? You expose it. You expose it. Then I'm going to get my KY gel from my assistant. I don't touch it. You know the reason? Cross infection and contamination. So after getting my KY jelly, I'm going to pass my catheter. Now I'm lubricating it. Are you together? I'm lubricating it. Now it is fully lubricated. Are we together? So what is going to come next? I'm going to use my free hand to hold my man and put him in position. Are we together? Then I start to do what? To insert within the urethra. I insert my catheter, I insert my man, I insert. What shows me that I'm inside the bladder, or I'm already in the bladder? For a man, you can insert this catheter up to this level. Are we together? You can insert it up to that level. What shows that you are inside the bladder? Remember our outline? Urine is going to be to show you that you are inside the bladder. Are we together? So you don't balloon until you see urine coming out. Because once you balloon, you're going to do what? To burst someone's urethra. Are we together? So at this point, I'm going to balloon. So my assistant is going to put our water in this syringe. We balloon with normally 20 milliliters of water for injection to 30 milliliters water for injection. So what is the science between the science behind ballooning? When you look at this catheter, this part is going to enter the bladder. It has openings. Then below it, we have a sac-like thing. You can feel it. It is the balloon. It is the balloon. We have put our catheter inside. We have inserted it inside the man, and we saw our first urine coming out. So that indicates that I'm successful. I'm inside the urinary bladder. Are we together? Then you see this part which has the orange cover. Normally it's red to orange. It is the inlet. So I'm going to get my water for injection. I put on my inlet. Normally it has some resistance. It has some resistance. Are we together? Yes. Then you push our water. Are you seeing what is happening? Are you seeing that big man being formed? Yes. Then you get the second one. We said it can accommodate up to how many milliliters? 30. So I'll put the first 10, then this is the next 10. Next 10. Now these are 20. Normally we put 20 to 30. So are you seeing this balloon? Yes. So this head, it's going to enter the bladder up to this level. So it's going to be inside the bladder. When you put in your water and make this balloon is inside the bladder. So this man cannot fall out. So it is anchored. I see. It will be anchored in the bladder by this balloon. I was saying this. You balloon when it is inside the urethra, when you have not yet reached the bladder, what is going to happen? It will burst. So the urethra is going to burst. What next? What next when you burst someone's urethra? This moves out. So now, when we are removing it from the patient, you bring our syringes. I hope this one is not blocked. You bring our syringe and we suck out the water. So I'm sucking. I see. Remember, I put 20 milliliters. Then I need to bring another one. Also. So are you seeing what is happening to the balloon? It has collapsed. So from the patient.
So its function is done.
When its function is done. Normally, for the patients who are having BPH, benign prostatic hyperplasia, they have, this is the bladder. So the bladder has this urethra coming out to your pelvis. So the prostate is just below here. The prostate gland. So when they have BPH, hyperplasia is just enlargement of this prostate gland. So when it enlarges, you're going to find that it is going to be compressing the bladder, the urethra, because it is passing within it. What will happen? Urine will not be moving from the bladder down to be urinated down. But will come and it will come and pass through this blocked part, and it enters the bladder. Are you seeing me? So this is our balloon. So our urine will be passing through this tube, and it will be going out. normally these patients with this enlarged prostate gland, we give them drugs which are going to bring this prostate gland to normal size. But the drugs are not going to work in 2 days. So it can be after months. So if it is, the condition is prolonged from 1 month to 2 months, normally we change this catheter in the interval of a month. After a month, the patient comes, you change the catheter, they go back. After a month, they come, you change the catheter. Until when the prostate goes back to normal size and the patient can urinate. Another complication is when you are doing an operation, normally cesarean section, and you cut the bladder. So there are some doctors who cut this bladder. When you're doing cesarean section and you accidentally cut the bladder, you repair it and you put a catheter for 2 weeks or a month. Are we together? Those are some of the complications of this leak. Another complication is you using normal saline to make our balloon. Normal saline contains sodium chloride, which is a salt. So it will crystallize out. When it forms crystals, you cannot suck it out. What will happen? You will have to use either ether to dissolve those crystals or to open the patient and you remove the catheter manually. Are we together? So that is our catheterization procedure.